Hi everyone, my name is Alyssa and I'm with Breastfeeding Counselor and IBCLC, or Internationally Board Certified Lactation Consultant. Today I want to talk to you about the basics of latching and how to get a really deep latch. Before I get started, I wanted to remind you that I will have new videos coming out, and I will also be sharing tips and tricks. If you need an in-depth lactation prenatal course, I have one available for you, and you can check the link below. So a little bit about the positioning of baby when you're getting ready to latch your baby. Sometimes it'll feel normal to put your hand on the back of their head. They have such a sweet, soft head. But when you push on their head, it's going to actually trigger them to lurch back with their head. And we don't want them to hyperextend when they're getting on. We're actually going to utilize the back of their use their back and use your fingers to help control their neck, and they're going to come onto the breast and you're going to help them come on. One thing you want to notate is reflexes on your baby's face, on their body. These reflexes are super important in knowing how to latch your baby. All right, so first of all, when you're talking about your baby's reflexes, they have several reflexes that are important to help them to latch. One of the main reflexes that is helpful for latching is called gape. So the gape is going to be the baby actually opening their mouth wide. So babies will open wide when they're coming onto the breast. So this is super important to know because babies will sometimes need some help getting that mouth wide open. They also will hold that open for a very short amount of time, and during that time, that's when they need to come onto the breast. But they will naturally open. So one way you can check and see how your baby is doing with their reflexes is you can check right here. You can kind of put your finger here below their lip, and you can kind of touch here with your knuckle. You can use the index finger, and you can open there, and it should elicit the response of opening. They do have a rooting reflex, which will help them turn side to side and open, but that's really not what we're going for when we're first latching them on. That is a good cue to show us that they're hungry, but at first we want to make sure they can open pretty wide. So check how wide they can open. They're naturally going to do that when something stimulates right here. So this is important to know because we're going to aim their chin at the bottom of the breast. So that's what you want to focus on. A lot of times when we're looking at babies latching on, I see moms who just kind of take the breast and kind of push the breast into the baby's mouth, the nipple into the baby's mouth. And while that might seem like the best way to do it to try to really take advantage of that baby opening, the problem is that the baby is not leading the charge. The baby sometimes will close up and clamp down, and so we don't want any of that to happen. So what we're going to do instead is wait for baby to open. Sometimes you're going to do that by using the bottom of your breast on the baby's chin. That is one way you can do that, by stimulating the bottom of the chin. You can also trigger this by pointing the nipple at the nose and doing a little test here, just kind of swiping the nipple at the nose and waiting for the baby to open wide. When the baby smells the nipple, smells the colostrum or the breast milk, they're going to also smell the oils that are excreted from the Montgomery glands, which are on the areola. That will help babies to understand opening up wide. If your baby is still really small, these are going to be the most helpful for your small baby under, I would say, 10 or 12 weeks of age. If your baby is older, they will need a different technique with helping them latch well. And you can see it in one of my other videos for checking out helping an older baby to latch. Next, we're going to talk about is the sucking reflex. The sucking reflex is pretty easy to think about because this is just your baby. Can they stimulate that suck? Can they suck on your finger? Can they suck on something, and so we want them to be able to draw the nipple back and then suck on the nipple, obviously. But we want to just do a real quick check of that sucking reflex. So you can literally just stick a clean finger, gloved finger in your baby's mouth and see, do they suck on your finger instantly? You might have to stimulate their palate a little bit. So inside, just stimulate a little bit, and they should hold on to your finger with their tongue, and the tongue should kind of make a little taco around your finger. And that's what they're going to do for the nipple. They're going to draw the nipple back, and it's going to create that seal there. They're going to use their tongue to suckle. All right, so those are the two reflexes that I wanted to talk most about. There are several other reflexes that are important that your baby will have. Some of those can be checked by IBCLC. So if you're feeling like there's something off with your baby or they're not able to latch on correctly, make sure that you get help from an internationally board certified lactation consultant or an IBCLC. And sometimes insurance will even cover those visits. You can do them virtually, in person. In person can be really helpful, but you may just find that you need a virtual support, and that's helpful too. So you can check your insurance and see if insurance is covered. There is a link below if you are needing some resources for checking insurance to see if insurance covers your lactation visits. All right, so we're going to talk about, let's set this baby up, and we're going to show you how to get a really deep latch. All right, and now a couple of things about positioning that I've already told you is we're going to keep our hand here around the back of your baby, and then we're not going to push on their head. The head is going to be a little too responsive to jerk back. We don't want that. All right, so what we're going to do is what I find is the easiest way to teach someone how to latch a baby on. Naturally, we want to put our baby in the crook of our arm, and we want them just to go on the breast, and then it's natural and easy, but it doesn't always work that way. That's not always the easiest way to latch. You kind of have to get the nipple right there perfectly in the baby's mouth, and they have to have all of their reflexes firing perfectly, no oral problems. So that is not always the easiest way to get them to latch on. What I find is that if you grab the opposite hand from the breast that you're using, so in this instance, I'm using my left breast, and I'm going to use my right hand to hold the baby. You can do this in a laid back setting, which is very ideal for the first few latches, and as baby gets a little bit more, I would say, in control of things, then they may find that you have to sit up a little bit more. But I do encourage you to relax your shoulders when you're getting ready to latch, because this relaxation of your shoulders is going to relieve tension, and you're not going to be putting that tension onto your baby. So when you're ready to latch your baby, you want to grab a hold of your baby here, and they're pretty easy to maneuver, but they do like to get these hands right there in the way. So their hands are going to go on either side of the breast. They're going to hug the breast with their hands, and that helps them to use their hands to guide them to the breast. So sometimes we'll trap their hands in like this, and imagine if you're in a straitjacket and trying to drink from a straw, that's not going to really work very well. So when you feel really restricted and you're held down, take the swaddles off. Let's take off all of the restrictions, take off the mittens. Babies will use their hands, even though it feels like, again, they're in the way sometimes. We want to train them to do it the right way, and then they're going to utilize those hands to help. So they're going to come around and they're going to hug the breast. So that's helpful. And we're going to point the nipple upward. So you can actually kind of take as long as you're not super engorged. If you're really engorged, you might have to relieve a little bit of that pressure. But we're going to angle our nipple upward, and we're going to bring the baby on. So the baby, we don't want baby like feet dangling, and we want to really help them feel secure, so they're going to feel close to the breast. So I'm going to do this one in a more upright position, and then show you how that works. So if we have the baby right here, we're going to point the nipple up. I'm going to stimulate down below where the baby's chin is, and that's going to help them use their gape and open up. When they open, they have a very small window of time that you want to bring them onto the breast. It's a quick, swift movement, and you're going to just basically engage that chin to the bottom of the breast. So we're going to embed that chin into the breast by pushing on their back gently, not being aggressive, but pushing gently onto their back. That's going to bring them in, and they're going to scoop up the breast. So they're going to anchor that chin in, and they're going to come up over the nipple, and then we can settle into the position that is the most comfortable for us. So again, baby's hands on either side of the breast. They might be putting their hands up close by the breast, and then their butt is tucked in and they're feeling nice and secure. You might even want to secure those feet onto a pillow or onto your legs, and that will help them feel nice and secure, like they're not going to fall. If they're feeling like they're falling, they may pull back and come off a lot. So if you're noticing that, you may need to try to just secure them a little bit better. It will take some practice to get good deep latch. So I'm not saying you're going to get it right the first time, but after you practice several times, you're teaching your baby to open up wide, and when they open, that will they will get the breast, they will get the milk. So you're reinforcing that positive behaviors. But babies are smart. They're using their instincts. They're using their sense of smell. They're using their touch. They're using their taste. All of these things are the senses they can use to get latched onto the breast. So we're just helping them. We're just helping to get them there. When they first come out and they want to do that breast crawl, they'll find their way. They'll bob up and down on to try to latch themselves onto the breast. But sometimes they need a little bit of help to get that nice deep latch. Sometimes there's tension in their jaw